So this is the continuation of part 3 of the training video. So in the last one, we talked about the signs and symptoms of COVID. Now here we are going to talk about how this disease spreads. But before we do that, last time, as you remember, you told the audience that this is not a very serious, dangerous disease, reassured them there's no need to worry, most people recover. So then it raises the question, why was a lockdown needed? So here first, before we talk about how it spreads, we'll talk a bit about that. Okay. So now you'll need to explain to people that there are some differences in this disease, which is why all this talk about coronavirus, everybody's talking about it, and so much of effort has been gone to prevent it spreading. So what is the reason? So first thing is that the virus spreads very fast, and lots of people can have this disease at a time. Now, why is that a problem? Now, that is a problem because, as we mentioned before, some of the people who get the disease, like for example, those who are elderly, like you can tell in the audience, parents of people in the audience, or your own parents, people of that age, above 60, 65, then people who have some other diseases already, like for example, diabetes, high blood pressure, some breathing difficulties like asthma or heart disease or cancer. So these particular people, they can end up having a more serious form of the disease. Even they get better, but they need care. They need to be admitted in hospital. Now, if lots of people get the disease at one time and a lot of people end up needing hospitalization, we will not have the available beds. We will not have available staff, doctors, nurses to look after them. And people who could have normally been saved with care, we would end up losing them. And we don't want that to happen. So the answer is that we try to make sure that the disease doesn't spread very fast, and that is why we needed the lockdown. So what was being done during the lockdown? So you ask people what happened during the lockdown. So people stopped going out, people stopped meeting, there was less contact, so the spread was stopped. The other thing was that during the lockdown, things were being made ready. Government was putting in place facilities to test, to identify people who have coronavirus, to then do contact tracing, then to have set up quarantine centers. Then, very importantly, you would have heard about COVID hospitals being set up in Goa. So places were being set up, facilities to provide oxygen, more beds in ICUs, ventilators. So all this readiness was being done during the lockdown. But now the lockdown is going to be lifted. Now that is because we cannot live in a lockdown forever and we have to get on with our lives and people have to earn. So the lockdown is being lifted. But there are some people who sort of think that now the lockdown is finished, the coronavirus is gone. There is no coronavirus disease. But this is not the case. So you have to explain to people that post lockdown does not mean post coronavirus disease or post COVID. What is important is that although the lockdown has been lifted, during the lockdown, people were made aware, they were told what needs to be done. Now, all this has to be put in practice. And we have to make sure that although we get on with our life, we take efforts, we make efforts and make sure that the disease does not spread. And it is the responsibility of all of us to do this. And so we are going to be talking later in the next part of the training, the video, or in the next part of your talk, you will be talking and telling people how to prevent spread. But before that, now we will talk about how this disease spread, how this virus spreads. Okay, so coming to how it spreads. Now here again, you can put this slide and then you can ask people, because a lot of people know how it spreads and they may not know all the details, but they generally know how it spreads. So you can ask people what they know and what they have heard about how it spreads. And then using what they answer, then you point to the figures and then you explain that there are 3 different ways. Okay. The most important thing is for people to understand 2 things. One is that this virus is in droplets of fluid which come out from our mouth or from our nose. Okay, so this droplet is in those, this virus is in those droplets, and the disease can be caused if somehow either directly or indirectly, these droplets enter into our body through the nose, the mouth, or the eyes. Okay, so these are the two focus areas. The virus is transmitted through these droplets, is present in these droplets, and it can enter our body through the eyes, the nose, the mouth. So this is the important thing. Okay. So now how this can happen? The first thing is, as you can see in the figure, you can show if somebody coughs or sneezes or also talks. Because remember, somebody who is asymptomatic, we mentioned earlier that a lot of people may not have symptoms, but when they talk, their saliva will still have the virus. And that is why we are being told now that everybody, not just somebody who is not well, but everybody has to follow certain steps. Okay. So that is because asymptomatic people can also transmit when they talk in their saliva. So either when we sneeze or cough or when we talk, then as you can see in the figure, you can point out the droplets come out, these droplets. Now, the first way of transmission is directly the droplets itself. Now, if somebody is near you, they may fall directly on that person. Those people may breathe in these droplets or they may fall on their nose, eyes, mouth, and then the virus enters their body. That is the first route. The second and third routes are through contact. Okay. And that is either direct. Direct is, so supposing somebody has sneezes or coughs and they do it into their hand. So you show how, somebody coughs or sneezes in their hand, and then they don't wash that hand, and then they just go and maybe shake hands with somebody else, two or three people, and that's okay. They shake hands. But if that person then takes that hand which has those droplets, if this person is infected, then that other person touches their hand to their eyes, nose, mouth, and then the virus can enter their body. The third indirect way is supposing somebody coughs or sneezes on their hand, and then they go and they touch that hand on some object. For example, they touch it on a tap or a switch or a door handle, and then somebody else comes and touches that. And that is fine. If they touches, that's not a problem. But they touch and then they touch their eyes, nose, mouth. And that is when the virus, which is in these droplets, then gets transmitted and goes in their body. Okay, so these are the three main ways. Now you can go to each of these ways and show the figures which elaborate it. So for example, the figure 1 shows how droplets, there's transmission directly through droplets. For example, when the person coughs or sneezes and you cough or sneeze on somebody directly when they're close on you. The second is through physical contact, direct contact with somebody. So somebody who has the infection goes and touches somebody else, and then that person touches the eyes, nose, mouth. So whoever this person who is infected has direct contact with, then those people can get the virus. And the third is indirect, where the person who has coughed or sneezed in their hand, then touch their hands, or they cough and sneeze directly onto some objects. Like say, these are examples. This doesn't cover everything. Say, for example, they have coughed or sneezed in their hand, and then they hold the handle to stand in a bus, or they use the same hand to open a tap, or they open a door, or there's a package, or somebody is working and during their job they are coughing or sneezing or using their hands on which they've coughed or sneezed to touch some pipe, and then somebody else comes along, touches these objects, and then, as you can see in the figure, touches their nose, their eyes, or their mouth. Okay, so these are the three main things. And even that, it is the case that the virus gets transmitted if there is a short gap between the virus being there on the surfaces and then somebody touching it. Okay, the virus doesn't live on forever. And after some time, it slowly sort of completely loses its life. It can only multiply and increase if it enters somebody's body. Okay, so if it just stays there and it remains on some objects, after a few hours, it basically loses its ability to cause the disease. Also, it's not the case that it is there in the air hanging everywhere. It is only in those droplets of water, and it is only when those are touched by somebody or they, land on somebody's face. These are the times when somebody can get the infection. Okay. So from this, what we begin to understand is that it is important for us to basically take care and not just keep touching things, keeping objects here and there. Okay? And amongst these objects we showed you, especially important is mobile phones. So it is better that, especially people might cough, sneeze, and then they touch their mobile phone. So don't touch other people's mobile phones. Okay? Or if somebody speaks in their mobile phone and their droplets are there, and then you take their mobile phone, then those droplets come directly on you. Okay? So these are the ways in which um, these things can spread. Okay? Now we will basically talk about the steps in the next section. We will talk about how we can prevent this spread. Now we know how it spreads and what are the different ways by which the virus can spread amongst people, enter in people's bodies. Now we need to go to the steps about how to prevent this.